Good evening, distinguished colleagues, honored guests, and friends. My name is Sumul Rawal, President-elect of Medical Society of New Jersey, and it is my pleasure to welcome you to tonight's MSNJ Policy and Strategy panel, Hidden Hunger in an Affluent State, Addressing Food Insecurity in New Jersey through Policy, Healthcare, and Community Action. When people think of New Jersey, they often picture prosperity, world-class healthcare, leading universities, thriving businesses, and one of the highest median household income in a nation. Yet behind this image of affluence lies a crisis that often goes unnoticed: hidden hunger. Hidden hunger is not simply the absence of food. It is the absence of adequate, nutritious food. It affects children who goes to school hungry, seniors who must choose between buying groceries and paying for their medicines, working families who hold multiple jobs yet struggle to put healthy meals on the table, and the patients whose chronic disease worsen because they cannot afford nutritious food. Food insecurity is not just a social issue, it is a healthcare issue. Poor nutrition contributes to diabetes, hypertension, obesity, cardiovascular disease, impaired childhood development, depression, and a poor outcome for cancers and neurological disorders. As physicians and the healthcare professionals, we see these consequences every day in our clinic and hospitals. Food is not merely a commodity. Nutritious food is a medicine. It is one of the most powerful preventing tools we possess. When children receive proper nutrition, they learn better. When adults eat healthy food, they remain productive. When the seniors have access to the balanced meal, they maintain their independence and dignity. A recent Physician Foundation survey of more than 1,000 physicians found that 55% encounters patients at least weekly chooses chronic disease care is compromised by the lack of access to healthy food, including nearly 1 in 4 who encounter this problem every day. 77% believe that addressing food insecurity would reduce downstream costs, including emergency department visits and hospitalization. Yet, 65% says the current healthcare system does not adequately support patients facing these challenges. The encouraging news is that hidden hunger is a problem we can solve, but only if healthcare, government, and community work together. Tonight, we are fortunate to hear from 3 speakers who approach this issue from complementary perspectives. Our first speaker will be Dr. Dan, Policy Manager for the New Jersey Office of the Food Security Advocate. Dr. Dan leads policy work concerning federal and state security programs and help coordinate food security efforts across state agencies, programs, and help coordinate and community partners. Before joining the Office of the Food Security Advocate, he worked with the Rutgers Cooperative Extensions and the Rutgers Institute for Health. Next, we will hear from Dr. Rachana Kulkarni, Director of Community Cardiology for RWJBH Health and a dedicated advocate for cardiovascular health, health equity, and community wellness. Dr. Kulkarni was recognized as 2025 NJB's Healthcare Hero and serves as the Vice Chair of Akshaya Patras USA, where she supports efforts to address childhood hunger and expand educational opportunities. She is also a past president of American Heart Association of New Jersey and is 2023 Physician of the Year. Our third presenter today will be Ms. Melanie Ernest, Director of Community-Based Program at Virtua Health. Melanie oversees Virtua's Eat Well initiative, leading efforts to improve food access and advance food as a medicine programming throughout southern New Jersey. Her work brings together healthcare professionals, community organizations, and residents to develop practical solutions that removes barrier to health and well-being. Following the presentation, we will have time for audience questions and answers, followed by policy discussion. My hope is that tonight's education and exchange of ideas will help MSNJ develop thoughtful, practical new policy in this important area. But first, we will have brief introductory remarks from medical student Anthony Kasumuso, a third-year medical student at Rutgers, New Jersey Medical School, an MSNJ member with a strong interest in health policy and advocacy. Over the past several months, Anthony has been working with his MSNJ mentor, Dr. Peter Blumenthal, to examine food insecurity as a measurable and actionable driver for health and a role physicians can play in connecting patients with available resources. Anthony, I will turn it to you at this time.
Thank you so much, Dr. Oval. I really, really appreciate that great introduction. So like he said, I'm just going to be giving a brief introduction. So I'll say again, my name is Anthony Cusimano. I'm a fourth-year medical student at Rutgers, New Jersey Medical School in Newark. I have a strong interest in health policy and advocacy, and I've been very lucky to work with Dr. Peter Blumenthal as my MSNJ mentor. And so I'm just going to give a brief introduction about this issue today. So the United States Department of Agriculture defines food insecurity as a household-level economic and social condition of limited or uncertain access to adequate, nutritious food due to a lack of money or other resources. An important note should be made here that food insecurity is not the same as hunger. Hunger is a physical sensation experienced by individuals, where food insecurity reflects broader financial and structural barriers to consistent access to food. This is a major problem in the United States. Tens of millions of Americans suffer every year from food insecurity. New Jersey is not immune to this, and an estimated 1.1 million residents, including about 270,000 children, experience food insecurity every year. This represents nearly 12% of our state's population, according to the 2024 New Jersey State Health Assessment. Food insecurity is often associated with only families in poverty or maybe sometimes families with young children, but it extends far beyond that. At Rutgers University in New Brunswick, on their main campus, more than 1/3 of undergraduate students and nearly 1/3 of graduate students have been identified as food insecure, according to an in-house study that they conducted themselves in 2018. Students found to be disproportionately affected included first-generation students, students from lower-income households, and students from racial and ethnic minority backgrounds. Another important finding from the study is that food insecure students have lower GPAs than their food secure peers, highlighting that food insecurity directly impacts academic performance and long-term opportunities. Another often overlooked population is our own healthcare workforce. Recent data published in the Journal of the American Medical Association indicates that nearly 25% of direct patient care and support staff report food insecurity. This raises important questions about adequate financial compensation, workforce stability, and the added stress placed on individuals working in an already demanding healthcare environment. At the same time, food insecurity remains highly prevalent among patients and is associated with worse health outcomes across people's lifespans. According to the Journal of the American Medical Association, children from food insecure households have higher rates of hospitalization, developmental delays, and poor overall health. As our health system continues to evolve, food insecurity must be recognized as a measurable and actionable social determinant of health. Tools, such as the two-question hunger vital sign, allow clinicians to screen for food insecurity in routine practice. Screening alone, however, is not sufficient. Proper action after screening requires awareness of available resources and strong partnerships with community organizations. New Jersey has many programs addressing food insecurity. Some include well-known programs such as Meals on Wheels or the Community Food Bank of New Jersey, as well as newer innovative programs like the MEND Hunger Relief Network and the Meal Recovery Coalition, which redirects prepared food which otherwise would go to waste. These programs demonstrate that solutions exist, but awareness, coordination, and access remain ongoing challenges. That concludes my introduction on this issue. Thank you so much to everybody, and especially Dr. Peter Blumenthal for giving me this opportunity and allowing me to speak at this meeting today.
Thank you, Anthony. That was a very good research that you did. And now, Dr. Dan, podium is yours.
Thank you so much. First off, I'd like to say what a pleasure it is to be here this evening. And I am truly honored by this invitation from the Medical Society of New Jersey. I'm hoping as a part of my presentation to do some level setting and provide some additional data in addition to what Anthony has already provided us to give you all a much more defined picture of food insecurity here in New Jersey, especially after the passage of HR 1. I also want to give a little bit of additional information around the New Jersey Office of the Food Security Advocate. We're really a pioneer when it comes to food security efforts. New Jersey really is leading the way. The Office of the Food Security Advocate being the first such office in the nation. And it's something that we're extremely proud of. I'm going to go ahead and share my screen. And let's start the show. So what is NJ OFSA? The New Jersey Office of the Food Security Advocate is currently the only food security advocacy office in the United States that is placed in the highest level of government, the governor's office. Established by NJSA 52-27J3, we are responsible for, among other things, cooperating with research organizations, working with state and community partners to develop a strategic plan, overseeing the development and implementation of public-private partnerships to address food insecurity. And our four focus areas are supporting state agencies. So we support state agencies in conceptualizing and executing programs that advance food security in New Jersey. That includes work with the New Jersey Department of Agriculture, the Department of Human Services, Department of Health, as well as the Department of Education. We lead several multi-agency task forces around the issues of food insecurity. We advise on food security policies, providing data, insight, and community connections that assist the governor's office, the speaker, the assembly, and the state senate in evaluating and executing policy. We advocate for philanthropic collaboration, bringing together the philanthropic community to conceptualize strategic philanthropic investments in New Jersey, which includes the New Jersey Food Fund, which is one of our leading philanthropic teams working in the food security sector. And of course, supporting our community coalitions where we provide advisement to community stakeholders from multiple sectors on collective impact and community-centered collaboration. So let's talk a little bit about the need. As I said, I want to do a little bit of level setting and provide some much needed data around the issue of food insecurity. As of 2023, which is the last year the USDA has done reporting around food insecurity, over 1 million individuals here in the state of New Jersey were food insecure. Our food insecurity rate was 11.7% as compared to 14.3% nationwide. That rate ranges from a low of 7.3% in Hunterdon County to over 14% in Hudson, with the 5 highest counties at being Hudson, Cumberland, Essex, Passaic, and Atlantic. And when we look at that rate of food insecurity among children, we've got over 271,000 children under the age of 18 experiencing food insecurity here in New Jersey. Again, that's a rate of 13.5% based upon 2023 data. Now, I do want to note that 2023 is not just the last year that the USDA reported, it is the final year the USDA will be reporting. Recent changes at the federal level have now meant that the USDA will no longer report on food security counts or prevalence in the United States, meaning that this type of work will need to be done more and more at the state level, which is one of the reasons OFSA is taking such a proactive stance in doing the research and unlocking the data to keep folks like yourselves and our legislators abreast of the most current trends in food security. As we continue to look at that need, we do have discrepancies based upon ethnicities, race. We see Black families and Latino families with higher rates of food insecurity as compared to their white counterparts. We also see among seniors, 8.8% of New Jersey seniors over the age of 60, about 200,000 individuals experiencing food insecurity as of 2023. And if you look at our trends from 2018 to 2023, our overall food insecurity rate has grown from 8.7% to that 11.7, and then among our children from 11.3 to 13.5. Now, one other point that I want to bring out, especially because it's one of the areas that I support in my portfolio, food insecurity amongst our military families is at almost 40%. A recent health assessment done of Joint Base Fort Dix, McGuire, Lakehurst showed 25% food insecurity just at the base. So this isn't just a situation that is specific to members of the public. We are seeing it in military families across the state as well. Exacerbating food insecurity is the recent limits on SNAP and Medicaid access imposed by H.R. 1. We have issues dealing with inflation and tariffs, and this doesn't just affect food costs for families, but it also affects our food security sector. And I do see a couple of familiar faces from the charitable food sector on tonight's call. Those inflation and tariff costs actually raise costs for our food security partners, those that use funds to purchase food or to pay for gas to deliver food. They're seeing higher costs, which means not only are they having to support more families, but they're actually trying to stretch their dollars even further in order to do this work. We also see continued growth of food deserts, which was mentioned earlier by Mr. Cusimano. And as I mentioned earlier, USDA 2023 is the last year that they're going to be doing this food security measure. So we're going to have to be doing it locally. And one thing that measure fails to mention is our families that fall into that asset limited, families that are working poor. They don't quite meet eligibility for programs like SNAP and Medicaid. They're making too much money, but they're not making enough to get by. So those ALICE limited population, which is extremely large here in New Jersey, they're the ones that are really feeling this pinch as well, because again, they don't qualify for those federal programs. So they're really taking the brunt of this and increasing the need amongst our charitable food partners. So let's talk a little bit about the impact of H.R. 1, also known as One Big Beautiful Bill. As I mentioned prior, there's been limitations on SNAP and Medicaid access due to stronger, more stringent able-bodied work requirements. Under old rules, states were able to apply for waivers that allowed states to better define the need, as well as to be a little bit more flexible on those able-bodied work requirements. Under H.R. 1, the rules are much more stringent. More and more families are losing access to programs like SNAP due to the inability to meet those work requirements. And now we're starting to see the same work requirements among our Medicaid recipients. We've also seen reduced access for refugee and asylee families due to the loss of their protected status. And then, of course, there's the financial burden with greater cost shares to states. There's an additional burden for admin costs, which before had been borne more heavily by the federal government. The state of New Jersey is now having to pick up a higher amount of those costs. And for the first time ever, benefit costs are now being shared between the federal government and the states. And based upon error rates, which, is a percentage of either over or under payments to SNAP recipients, New Jersey may see a larger or smaller share of those benefit costs based upon our prevailing error rates. Now, we can reduce those error rates and potentially eliminate our benefit cost, but there's a lot of work to be done in order to make that happen. But I do want to note in the governor's recently passed fiscal year 27 budget, the $95 SNAP minimum has been protected and enshrined in the fiscal year 27 budget. So New Jersey continues to lead the way in ensuring that individuals receiving SNAP at minimum get $95 per month to help offset the cost of groceries for themselves and their families. As per the Center for Budget and Policy Priorities, SNAP participation fell nationwide by more than 4 million people from July 2025 to April 2026. That's about a 10% decline. New Jersey's participation is down about 5%, around 40,000 people. Approximately 70% of New Jerseyans losing SNAP are children 18 years and younger. Now, we're going to see even larger increases in losses among SNAP because May marked the first month that households could lose SNAP due to not meeting those able-bodied work requirements. So as more and more households do not meet that requirement, we'll see even greater numbers in loss to SNAP benefits. So again, this is only going to snowball, and it's only going to continue taking a sector like our emergency food sector that is already overwhelmed and is actually going to make things worse. As I just mentioned, the charitable food sector is reporting increased need. We're seeing upwards of 20% increases anecdotally. We continue to work with our charitable food sector through the $85 million Food and Hunger Grant, which supports our 6 largest food banks in the state. Again, New Jersey really has taken the lead when it comes to working in the food security sector. That $85 million actually began back in COVID and has grown to its current $85 million budget budget allocation. But the work that it is supporting is monumental. The pounds of food that this grant is able to allow that sector to purchase to support families across the state is immeasurable. And again, it's one of the ways that New Jersey is really trying to help reduce food insecurity by allowing these food banks to connect more families with food supports. Households are continuing to have to choose between food, housing, medicine, affecting both physical and mental health. And that's going to basically result in additional increases in chronic disease due to lack of food, as well as poor diet quality. As I mentioned in our conversations before we started, when families have to choose what to purchase with limited funds, it's so much more expensive for them to buy healthy, to spend $4 on a gallon of milk versus 69 cents for a 2-liter bottle of soda. Because these calorically dense, high caloric foods are so inexpensive, these are what folks are reaching for because that's what they can afford. It allows them to put a meal on the table. So the domino effect of One Big Beautiful Bill is not only this lack of food, this lack of purchasing power, but it's going to mean even poorer diet quality among those families that are struggling to make ends meet. And then also in this federal environment, families are withdrawing for safety net programs out of sheer fear. It's not that they no longer qualify, but they are fearful due to changes in things like public charge, families that may have eligible household members that may be mixed, composed of both U.S. citizens as well as non-citizens or undocumented. Out of fear, they are withdrawing altogether from programs like SNAP, the Special Supplemental Nutrition Program for Women, Infants, and Children, National School Lunch, and National School Breakfast, because they are afraid the data will track agencies like ICE to their door. So we're literally seeing folks drop away from these programs out of fear for themselves and their families. So how are we trying to mitigate the impact of H.R. 1 here in the state of New Jersey? First and foremost, the Office of the Food Security Advocate earlier this year released the first state strategic plan around food insecurity. The 3-year strategic plan was composed by a cross-sector executive team composed of folks from government, from the nonprofit sector, the food security sector, state farmers, healthcare agencies, academia. It is one of the most comprehensive and concise plans that have ever been developed at the state level to address the issue of food insecurity. We continue to support volunteer activities. The state and other organizations such as Rutgers are creating websites to help connect households with volunteer opportunities, which would allow them to meet their able-bodied work requirements under H.R. 1, which will hopefully shield them from the potential loss of benefits. And we are also pushing more families with children under the age of 5 to stay in WIC. Most families, once children start on complementary foods, will shift their children out of WIC and into SNAP. Right now, WIC is not seeing the same type of comprehensive legislation to prevent or restrict access to WIC programs. So we are working with families to cross-promote WIC as an opportunity to increase access to nutritious foods in support of healthy growth and development. And the one thing that's beneficial about WIC, it is less impacted by tariffs and inflation. Families are traditionally given vouchers or funds to purchase specific food items. They may be restricted to certain brands and certain sizes, but it's less restrictive or less impacted by cost shifts. So if that gallon of milk is $4 or $3 or $2, because WIC has said you get a gallon of milk, that household will still get that gallon regardless of changing costs. We are also leaning into school meal programs. Right now, there are no citizenship or residency requirements to participate in either National School Lunch, school breakfast, or the child and adult care feeding program. We're making sure that our public schools and especially our non-public schools understand their eligibility to participate in these programs. Daily, I'm working with schools across the state, especially in the non-public community, Catholic schools, schools that are serving our Islamic families, schools that are working with children that have specific medical or physical or other handicaps. We're making sure they are aware of their eligibility to enroll in these programs and connecting them with our partners at the New Jersey Department of Agriculture to ensure they can get the necessary paperwork in to actually become a site enrolled in these programs. And of course, at the state level and here in the Office of the Food Security Advocate, we continue to make investments in the food security sector. Looking at the state strategic plan, a couple of things I just want to go over real quickly as our focus areas. There are 5 primary focus areas of that state strategic plan. Focus area 1 is to enhance information exchange and access to improve public awareness, optimize programs, and support data-driven decision-making. Focus area 2 to expand community-based food infrastructure and market channel creation for enhanced ongoing food access, utilization, and availability. Focus area 3 to build and support local partnerships to advance community-driven food security approaches. Number 4, to collaborate across sectors and state agencies to streamline and strengthen federal and state food security related programs, access, and delivery. And finally, focus area 5 to strengthen food systems resiliency to enhance long-term stability that withstands disruptions and ensures future sustainability. And in support of our investment in food security here in the Garden State, we have the New Jersey Food and Hunger Grant. That's the $85 million that is allocated by the legislator to support our charitable food sector. We have the NJ Feed Grants, which were done by our Economic Development Association to support development and investment in our food deserts. Just recently, as actually today, this morning, we announced our first class of Rooted and FSEP grant recipients, which are investments in the food system and the food security sector. We will be announcing in the next few weeks the recipients of our Building Enhanced Access to Nutritious School Meals grant, which will support increased access and participation in our school meal programs. There is also funding available at the state to support food recovery and gleaning programs. As I mentioned earlier, the New Jersey Food Fund, which is supported through our philanthropic partners. And then there's our federal nutrition programs, such as TFAP, which is the Emergency Food Assistance Program, and our commodity food programs, as well as our recently launched Summer EBT program, which is now going into its 3rd year. And in just last year, provided over 700,000 children with a EBT card of $140 that allowed them to purchase groceries over the summer months to replace school meals during the time that our schools are closed. It's an amazing program, federally supported, and New Jersey is truly a leader. Now, my ask of all of you, how you can help. And this is something that Mr. Cusimano brought up earlier. Number one, first and foremost, as a part of visits with your patients, please screen for food insecurity and ask about participation in federal programs if they do screen positive. Make referrals to our SNAP navigators. New Jersey is one of the states, one of the few states with a robust SNAP navigation program, as well as making referrals to our WIC offices for those families that qualify. Know your local emergency food sector. Be able to identify where local community kitchens are, pantries, food banks. Know where your local county offices are for WIC and SNAP applications. And more than anything else, advocate for food security programs, for childhood nutrition programs, increase federal support of nutrition programming, advocate for our emergency food sector so that our food banks continue to have the funds needed to support the many, many families that connect with them and look to them to put food on their kitchen tables. So I hope that this provides a pretty robust picture of the food security picture here in the state of New Jersey. And with that, I'd like to turn it back to our hosts.
Thank you, Dr. Dan. This was probably most comprehensive information we received from a state. So thank you. This was very, very helpful and hopefully make a big difference eventually. Our next speaker is a good friend and a prominent cardiologist, Dr. Kulkarni. Podium is yours. Let's hear from Dr. Kulkarni.
Thank you, Dr. Raval. Of course. I'm going to present, we all have established now that the food security scene in New Jersey is, it really boggles our mind because we are considered one of the most affluent states. And still, when I started looking at it, the food insecurity was mind-boggling. So what I'm going to share is how individuals, communities, we come together to address and help in this issue as much as we can, because this is everybody's state. So as we have established, food insecurity, and for the purpose of our effort and our discussion, we decided to focus on college students, because what we realized is that there are a lot of programs that are available for school children and that sector, but food insecurity persists in college students, and nationally, 23% of undergraduate students, which equates to almost 4 million students, experience food insecurity. And more than that, more students they struggle to afford balanced meals, because otherwise, like what you had said prior to that, that everyone eats Burger King. Why is that? Because that's the only thing that they can afford. And then as a cardiologist, I see the downstream effect of having Burger King or not nutritious foods, because then that increases the prevalence, incidence and prevalence of chronic diseases. And we all know that, and of course, I'm going to talk about cardiovascular disease, lipid problems, heart disease starts earlier and earlier because people are not making good food choices and because they cannot afford good food choices. And as Dan had mentioned earlier, that in spite of receiving SNAP benefits or not taking SNAP benefits, which is also a trend we are seeing, they still experience food insecurity. Next, let's see. So we decided to concentrate our efforts on New Jersey community colleges, where we saw that there is almost 40% have experienced food insecurity. And when we started digging deeper, when we reached out to New Jersey community colleges, the presidents, the management told us that there is significant insecurity and please help us. The insecurities went from food also, housing, homelessness. So it was just heartbreaking for us. And as we can all imagine, there was significant impact of lower academic performance, which was measurable in association. And it was significantly higher amongst women, Black, Hispanic students, commuters, and financial aid recipient. So we as a community group, we thought, what can we do about it? Because in our regional backdrop in New Jersey, as you had mentioned before, there is statewide food insecurity, but it's more in Essex County, Middlesex County. And as we mentioned previously, a lot of New Jersey residents who have insecurities don't even qualify for SNAP benefits. So our answer, our effort as a community organization, as a volunteer organization, was the genesis of World Food Movement, which is a global initiative dedicated to providing free and nutritious meals to the students. And when we started doing this in the United States, we started with community college students and a small sector of food insecure individuals. But before I explain
Sorry to disturb, Dr. Kulkarni. Do you want to share your screen? If that is more helpful for your. Do you want to share your screen if that is more helpful?
I'm not. Oh, I'm sorry. I thought I was sharing my screen. Oh, sorry. I thought I was sharing my screen. Sorry about that, guys. Oh my gosh. Thank you. Thank you for bringing that to my attention. Thank you. So that was World Food Movement. And so I'll spend a few minutes about saying what prompted us to make the organization World Food Movement. I'm vice chair of Akshaya Patras USA, which is again a global organization that serves 2.35 million meals every day in India to kids who are underprivileged. And the beauty of Akshaya Patras, what drew me to that was $20 feeds a child for entire school year. And we have seen downstream benefits of that with higher nutrition rate, education, retention of kids and girls in the school system. So I always was attracted towards intersection of food and education. The organization has been honored by United Nations for addressing the needs of hunger and education, which are their SDGs. So in 2 years ago, we were honored by United Nations. And because of that recognition, now multiple nations have reached out to us to implement the same program with government's help. And currently, Akshaya Patras, which is my inspiration, we have knowledge partnerships and we have started programs, similar government and public-private partnership programs in Indonesia, Kenya, Sri Lanka, and Rwanda. So our question was then that's great, but what can we do in the US? So we started focusing again on the sector of where is the most help probably is needed and they're not getting enough benefits. So we started in the college feeding program. So what we do is provide hot, nutritious, fresh meals served to the community colleges. So currently we are actively serving at Rutgers, NJIT, New Brunswick, and also Middlesex College. So these are the community college. We recently started serving at Raritan Valley Community College as well. In addition, we serve in New York, Staten Island, Kingsborough Community College, and Medgar Evers College in New York. So overall, we serve 550 meals per week. It's a sliver. The need is so much. We have been asked by so many other colleges to come and serve, which is where we are going to need everybody's help. But it's a volunteer organization. We go there. We have a huge panel of volunteers. We go there. We pick up a day of the week, go and serve hot, nutritious meals. The students have to register. And we serve in a common area, and I cannot tell you how many student testimonials we get thanking us and telling us that because of that, that prevented them from withdrawal from coursework. It also, they told us that other option was going to soup kitchens, but this protects our dignity. So it's just so heartwarming. We have seen outcomes, the food insecurity goes away, impact on college students is enormous. Academic performance improves, they retain in the academic organization. Of course, physical health improvement is there, and their risk of chronic diseases in the future goes down. They feel financial and emotional relief. So that's what I wanted to share with you. We need support. If we can provide, or if we can reduce food insecurity for college students, New Jersey can continue to be a state that we are proud of for providing the best education. Thank you so much. Thank you.
Thank you, Dr. Kulkarni. I think Akshaya Patras is doing tremendously amazing job worldwide, providing hungry children. And now I learn your college students. So that is kind of a new thing for us as well, that you guys are started doing it. So thank you for that. That was very useful program. And this is the whole purpose of this, so that we can exchange information and ideas, so that we can learn from each other and do more better for the state of New Jersey. So thank you, Dr. Kulkarni.
Thank you.
And our last speaker of the evening, Melanie Ernest, Director of Community-Based Program, Virtua Health. Melanie.
Thank you. Thank you so much. Happy to be here tonight. And I was very pleased, Dr. Kulkarni, to hear you speak to the food insecurity that happens on college campuses. I sit here by the grace of God as one of those college students who was food insecure, and probably that influenced the work that I'm doing now.
Thank you.
I'm going to share just a little bit about how Virtua Health is looking to impact community and population health through our Food as Medicine programs. So, there we go. Better. Can you see my slides? Well, thank you. We've all talked about how food insecurity touches all of our lives, but what we know, and that not everyone knows, is that food insecurity, or food security, if you want to look at it from a positive, really sits at the intersection of multiple social drivers of health, and it influences our health outcomes in ways that show up years later, right? There was an old joke that my dad liked to tell: an apple a day keeps the doctor away, but only if you throw it hard enough. But really, there's so much truth in that. What we put into our bodies influences the outcomes that we have years and years later. Chronic disease management, wellness, health equity, it's all tied to food access and food security. At Virtua, we look at food as medicine, just as many of you do. And food as medicine, as you now know, or there's a widely accepted definition of it now. This was very new when I started working at Virtua Health a few years ago. Food as medicine was a relatively new concept, But now we know that food as medicine is a philosophy where food and nutrition aid individuals through interventions that support their health and wellness. It influences chronic disease management, cardiovascular health, medication adherence, healthcare utilization, patient engagement. And part of the problem is not necessarily knowing what to eat, but how to access the foods that impact our health. Addressing food access isn't just a community intervention. I'm a social worker by discipline, so a lot of the time this would fall sort of into my lap if there was a patient who was food insecure, or there's a family who's food insecure. But it really is a healthcare strategy that we can all look at to impact outcomes and advance health equity. This map is particularly impactful to me, looking at the difference in life expectancy in a less than 7-mile span. The difference in life expectancy from Camden City to Cherry Hill. This is an area, both service areas for my programs. I live in the vicinity, 6.5 miles and 16.5 years. What's different between the two towns? They're so close. What's different is access to quality foods, access to nutrition, access to good health care, and having a care team that is open to engagement around food security and food access and how that impacts patient health. Eat Well, which is my program name. It's a little bit corny. There's a lot of food jokes in here if you'll let me. But it's an innovative suite of food as medicine programs. So Virtua was the first healthcare system in the nation to offer food access as part of our community care. As a result of the 2016 Community Health Needs Assessment, 2 of the areas that were identified as areas of biggest need were transportation and access to healthy, affordable foods. Since we couldn't really influence infrastructure on streets and roads, we decided that we would look at nutrition as an intervention, and we would take it on the road into neighborhoods and communities where they didn't have ready access. So our mobile farmers market program was born in 2017. It looks like an airport shuttle or a food truck, but it is filled with fresh fruits and vegetables. And we found that there was such a need for that we just grew our programming from there. We are out in the community year-round. We're more reliable than the Postal Service, I think. Neither sleet nor snow nor, we're there regardless of weather, unless it's dangerous condition for consumers. If it's more than 105 degrees and the heat index are lower than 30 degrees in the winter months, we'll suspend service. But otherwise, we have a regular weekly schedule. We're at the same place at the same time, week over week, building community trust and engagement and bringing deeply discounted foods into neighborhoods where they're really needed. We also bundle preventative healthcare screenings. So we're taking blood pressures once a month at each of our mobile market stops. We partner with Rowan University and we host their 5th-year dietetics students. So they provide nutrition education, and it also opens the eyes of the students because maybe they haven't seen food insecurity before. So they can enter their practice when they graduate with a good understanding of what nutrition really means. I think it was mentioned earlier on this call, doctors don't necessarily have a lot of background in nutrition. That's for dietitians. Well, dietitians don't have a lot of background in community need. That's for social workers. So we've created a channel to all look at things from a collective lens. The big sister of our mobile farmers market program is our mobile grocery store program. This is where Virtua really shines as an innovator. Our mobile grocery store was the second in the nation, the first launched by a healthcare system. And we've been able to mentor other healthcare systems throughout the United States. I sit on a steering committee on the National Mobile Healthcare Association, and they're taking a closer look at food as medicine and how that can be expanded throughout the country with innovations like our mobile grocery store, which today, it started on a New Jersey transit bus that we were given the opportunity to purchase for $1. We turned it into a one-aisle grocery store, and Betsy, as she was affectionately known, was with our team for about 5 years. Last year, we were able to replace her with a custom-designed 45-foot RV, which is not just a mobile grocery store, although you walk in to a produce aisle and we have proteins and dairy and bread and really everything that you could need to help supplement your diet. But we also have a clinic component to the mobile grocery store. So again, we're trying to keep health top of mind for consumers who come on board and shop with us. Through grant funding, we're able to offer these foods at between 30 and 50% below average retail cost. So we really are making them affordable and accessible in food desert communities. Typically, we'll partner with affordable housing communities or senior housing communities where there is either a lack of full-service grocery store or where transportation isn't easy. And because we have that same schedule week over week, month over month, we really do build community trust. Our marketing department would like me to say that our mobile programs are another front door to the healthcare system. But I will tell you that we are a front porch to the healthcare system. We're a place where neighbors can come and sit and talk and share, and then maybe later decide to go in. And I think that's exactly where we need to be in community health. The third component of our Eat Well programming is the one that I am most pleased with because it is so impactful to our patient lives. We have a program called a food pharmacy that serves patients of our healthcare system who are managing a chronic diet-related health condition. Type 2 diabetes and hypertension are the top 2 drivers into our clinic. But the patients are also screened as food insecure. So they have to meet those 2 conditions to be referred to our food pharmacy program, where they receive one-on-one medical nutrition therapy with a registered dietitian once a month and leave with a complement of medically tailored groceries to support their health. They also leave with produce prescriptions. We partner with the Food Trust in Philadelphia currently for those produce prescriptions called Food Bucks. But there are a number of other produce prescription solutions throughout the state. That's just the one that works the best for our service location in Camden County. But what we've seen with our patients who come into the food pharmacy is they're grateful for the medically tailored groceries because now they know, and the nutrition education because now they can go. If they're reliant on a pantry, they can go to the pantry and they can make more educated choices about how to support their health. We decided medically tailored groceries was the best approach instead of medically tailored meals, which was sort of all the rage a year or so ago, right? Medically tailored meals. Meals can influence one person's health. Medically tailored groceries can influence the health of the family or the household. So that's where we are building our case. As for food as medicine, we have seen clinical clinically significant reductions in both systolic blood pressure and A1C for patients during their 6-month intervention with our food pharmacy. These results are much higher for patients who come to us with uncontrolled conditions, but on average, 25% of patients see a 0.5 reduction in their A1C over the course of our food pharmacy intervention, and 38% of our patients see a reduction of 10 points in their systolic blood pressure, really demonstrating the impact that diet has on these conditions. We also address some social needs of our patients while we're there. Some of our patients are in transitional housing, so they may not have the appliances that we enjoy in our homes. We're able to also provide them with air fryers or other tabletop appliances so that they can prepare their foods. These were made possible by some generous gifts from partners. LabCorp provided us with air fryers. My team has a supply of cooking utensils, can openers, and measuring cups and spoons and things so that nutrition is always a little bit easier to manage and understand. But we're really seeing a lot of impact through these programs. Measuring the impact has been probably the proudest moment of my tenure with Virtua Health right now, or at least to date. We'll see. Ask me again in a year what I'm most proud of. But today, it's looking at those numbers and looking at the impact that we're having with our patients. But Virtua is not the only healthcare system that can influence this. All of you can influence patient health. And I know I sound like a broken record at this point because now all 3 of us who've presented are sharing the same information. Physicians, please screen for food security. Refer your patients to eligible programs, whether it's within your healthcare system or whether it's a community resource. Reinforce healthy eating as part of a healthcare goal. Collaborate with other practitioners across a variety of fields, social workers, dietitians, community partners. And as Dr. Dan mentioned, advocate for policies that support food access programs and support improved health outcomes. And with that, stop sharing my screen. Thank you so much for allowing me to be here with you tonight. Very grateful.
Thank you, Melanie. We want you to convey our message to the Virtua that we want to congratulate and thank them and all the administrators for initiating such a unique first-in-a-nation program, and hope that all the private as well as non-profit system in our country, especially everywhere, including New Jersey, learn from Virtua Health and set up programs like this that can benefit so many people in many ways. So thank you for what you guys do.
Thank you.
So at this time, I would like to open the floor for the question and answers with our speakers. Anybody who have a questions can unmute themselves and ask the question to the speaker.
Hello to our speakers, Dr. Dan, Dr. Kulkarni, and Melanie. Phenomenal job. I'm Dr. Kennedy Ganti, fellow, and also now the new vice chair of the Justice, Equity, and Diversity and Inclusion Task Force, co-chairing with Professor Emeritus Bob Like, who's also on the call. And we've explored this very intensively, and I think this is an excellent area for the medical society, especially our task force, to continue our work. And I also want to express gratitude to Virtua. As a former Virtua, as a Virtua alum, I suppose, Virtua has a long history of setting national firsts. I remember when I was there, Lean Six Sigma, right, Dr. Campanello? And you guys continue to innovate. And so amazing, amazing program. I mean, such that I'll rise to a point of personal privilege that I have some guests from my current system, RWJ Barnabas Health, and we just implemented a food pharmacy within our community health system. And I have I'm fortunate to be the clinical site director, and we are now focusing on applying our food pharmacy to hospital readmissions and focusing in our Healthy Lives Heart Failure program. How can we identify insecurity? How can we help our patients? Can we develop heart-friendly initiatives? So, and I also know that just heard that Dr. Kulkarni is also with our system. So I'll be reaching out to you separately for your guidance. So thank you for making this one of the great, most memorable programs that we've had at PSB for a very long time. And it's given us a lot at MS&J from a policy perspective to help craft and align ourselves with many of you on this critical thing for all of our patients across the state. Thank you.
Dr. Robbins?
Yeah, so I had a question for Melanie, and obviously want to thank everybody for the great presentations. So in terms of sourcing some of the fresh vegetables that you're bringing, do you have any opportunity to support local farms? Because I know that that could be a financial challenge, but on the other hand, you know, it kind of gets at the triple aim of supporting sustainable farming in an era where climate and environment is another important feature of our patients' health.
Thank you for asking that question. Shame on us if we don't source locally. We're the Garden State, and I am fortunate to live in Burlington County, which is part of the state where we got that name, right? So we do source locally. Up to 85% of our produce is sourced locally in season. We have a relationship with some larger farms, but also we work with the common market to source. They work as an aggregator for small farms, and we also work with Rancocas Creek Farm. They serve the same role as an aggregator across smaller farms, some of them urban farms. We have a partnership with a hydroponic farmer, so we're able to source leafy greens year-round, fresh. And what we can't source locally, sadly, we will not have Jersey fresh mangoes, which are very popular among our Hispanic patients, but our aim is not just to support food access through our programs, but to support the local food economy.
Fantastic.
I'm also pleased to share with you that anything we have left at the end of our work week, if it is fit for human consumption, we donate it to a soup kitchen that prepares it. And if it is not fit for human consumption, we work with the Burlington County Animal Rescue, and it is converted to animal feed.
Great.
Awesome.
Dr. Campanella?
Yes. Hi, and thank you to all the presenters, but especially Melanie, because I'm very proud of what we've been doing at Virtua, and you really explain things so well to everyone. And thank you so much. And, I just wanted to attest as a clinician in Virtua, we've really developed a way that we can screen people regularly through Epic, and then also refer them to her program, especially the food pharmacy, very easily through Epic. And then we get messages back, based on, sometimes there are patients who aren't eligible for whatever reason, but usually they are accepted. And then I've been just so impressed with some of the patients who come back after being in the program for a few months even. And I just had a lady the other day who looks totally different, so much more relaxed, shine in her face because she was getting the right foods and nutrition. Couple of questions I had was just, first of all, I saw in the chat there was a number, I think some of the students and other people were asking about volunteering and how do students get involved in this. And so I didn't know if each of the presenters had some things they could give us. Maybe we can develop a database for the Medical Society to make known where people could get involved more easily. And then the other question was, kind of similar, this is the Garden State, and I'm a gardener myself, and I was just wondering if any of the programs are really designed around helping people to learn to garden and grow their own foods. I'm involved with the Philadelphia Horticultural Society, and there's a lot of places where there've been pop-up gardens in some of the vacant lots and things like that. So I was wondering if that might be also something the medical society could encourage and support if that's going on in the state in locations, or whether we could start some of that. So I was looking for people's input on that.
Mary, I think that's a great idea. In fact, based on some parallel efforts that we have worked through MSNJ and JEDI, and we're looking at the One Health, not One Health New Jersey. That's our separate effort, but the One Health initiative that brings, a lot of multiple stakeholders for sustainability going forward. So, uh, a huge part, I think, the Office of Food Security, Dr. Dan, is also part of that initiative. So we're looking at multiple linkages. Really, again, climate change, sustainability, food insecurity, all of these are, absolute critical spokes of the whole health drivers and social determinants of health picture. And again, Mary, again, what Virtua has done and historically done for communities now leads the way. And hopefully, rest of us will be able to work with you and get some ideas, especially on that epic bill that you guys got.
If I could respond to the question regarding volunteers, I did see some representation from our charitable food sector on tonight's call. That's really the best place to start. Our charitable food sector is always looking for volunteers to pack boxes, to work with consumers that are coming for support, whether it's, helping them unload shipments or, put food in folks' hands. We have 6 regional food banks as a part of the Food and Hunger Grant, and they in turn support hundreds of local distribution agencies, community kitchens, and pantries across the state. I know Melanie mentioned earlier one of the kitchens they support that we work with, Cathedral Kitchen down in Camden. There's numerous kitchens, the Trenton Area Soup Kitchen, there's Elijah's Promise. There are some wonderful opportunities for volunteerism for our students. And for those that might be looking for internships or to get some more understanding of this area, also, we have taken on interns in the past. I have an amazing intern this semester from Rutgers, who has been nothing short of amazing. And so we always welcome students that have an interest and a passion for this work. We want to develop the next generation of leaders in the food security sector.
Any other questions? So I'll just ask one quick question. For all.
We have a question from a guest.
Sure.
Diane, do you have a question?
Well, I have a comment.
Okay.
So I'm Diane Grillo. I'm the Vice President for Wellness at RWJ Hamilton. And Dr. Ganti and I work very, very closely on all the food insecurity initiatives. And one of the things I just want to say, what great presentations here tonight. And I'm so happy to hear so many people and so many physicians. I mean, one of the things, and Melanie, like we have a food pharmacy as well. And one of the things that I think is so important is like the education model. So in Hamilton, same thing. We partner with our physicians because we need the physicians because they help us support that education model that we've developed at Hamilton. So the Hamilton Food Pharmacy has community health workers, RDs, social workers on site, and as part of the education model, because we know lots of organizations are giving away food, and that's incredible across the state. But it's the education that really comes with changing people's lives, reducing the medication. And that's where the physicians come in. They play a key role. And so I can't tell you the number of hours that both Dr. Kennedy and myself spend in educating even our physicians about the importance of referring their patients. And it's interesting. I went to a specialist's office, and he said to me, "Well, this is a great program, Diane. Really, really kudos to the team for setting this up." And he said, "But this really belongs in the primary care, not in my GI practice." And guess what? His MA was next to him, and he said, "Doctor, I would apply for this program. I qualify." So we don't even know the people that are around us, that are, food insecure. People aren't wearing those, that label across their chest. But we know, and we've heard it today with all the stats, that there are people across the state and beyond that are food insecure that we can help. Barnabas is fortunate that we have funding, state and federal funding. I do local funding for the pharmacy, but the money's there, the food is there. We just need the referrals from the physician. So ours only opened, the end of January. So we're still in the building phase. But to the question earlier too about are there other things? And it is our part. We have community partners, the food bank, the farmers, and then of course Barnabas Health for the support. But we also have it's called Farm to Family. Now that one we've had for like 10 years. So we're at local community centers with an RD because our model is always about education, weekly during the growing season. So the 16 weeks, giving out CSA shares with education, same thing. All the recipes, the dietitians cooking, sampling, because oftentimes people get this food, they don't know what it is, they don't know how to cook it, so it lands up in the garbage. So we don't want that to happen. Education stops that from happening. And from that program, we have community gardens. And so families get a garden for a year with a master gardener and our RD out there talking to them about, how to cook how to cook the vegetables, and that you can even grow it after your year when another family comes in. Hopefully we taught you how to just grow it, even if you have a small piece of land or just pots on your porch. But it is a constant work and reminder about it. Just look around. It's probably your neighbor that's food insecure. So thank you for all the work everyone is doing on this. In Hamilton, we're right on the border of Trenton. So a lot of this, and you brought it up earlier, is policy change. We have to fight for the policies to change in our nation. So thank you again.
Dr. Light.
Yes, good evening, and my thanks also go out to all the presenters for giving us an enormous amount of food for thought, but most importantly for collective action. And so one of the things I just wanted to mention is we had an opportunity to meet with Mr. Dychtwald back in January of 2025, and in the chat, his meeting with the JEDI task force members led to a number of ideas which I posted for consideration by PSP as things that might be pursued. And I hope it was okay, Dan, if I included the list of counties and activities that you shared with us in January. I'm sure there's much more going on as well, but that's been posted. The question I have, probably more for Dan now, would be how can physicians and MSNJ become more involved with New Jersey's strategic plan? And also you have a Garden State Conference on food security, because the plan doesn't speak as much about the role of clinicians and public health people. So what are your thoughts about what would be most practically useful to do?
Dr. Like, I love that question. And I'm going to say right now, I've just pulled out a seat for all of you to join us. We would love to have your presence as a part of this work. The Garden State Conference on Food Security, this will be our third conference. It will be down in Mount Laurel in October, later this year. I believe it's Tuesday, October 13th, but don't quote me. I will follow up with an email. This year's theme will be nutrition or food security through the life course. So having physicians present at this conference would be a welcome addition to the information. Not that we don't already have presence. Virtua has always been one of our biggest supporters. In fact, both Virtua and Robert Wood had representation as a part of the executive team in putting together our strategic plan. I would say connect with our advocacy organizations. Hunger Free New Jersey is one of our leading advocacy groups in the state of New Jersey. They lead some coalitions around food security. They help to advance the program, which expanded programs like Breakfast After the Bell. They advocated for the addition of a link to the school meals application on all school district websites across the state. So contacting and connecting with Lisa Pitts, who is the executive director of Hunger Free New Jersey, is a great step. And then within each of your counties, we have 13 county-based coalitions here across the state doing collective impact work. Counties like Essex County, like Camden County, Monmouth County. We've had more and more coalitions coming online each day, and they work only by having a cross section of representation at the table. Folks from healthcare, from the food security sector, from policy and advocacy work. So definitely get in touch with your local county coalitions. If you're not sure if there's a coalition in your area, reach out to me. I'm happy to connect you and provide you with a list of county coalitions and contact information. But that's a great way to start and connect with other leaders in your county to help support this work and better connect our families with the resources they need to put food on the table.
Thank you.
Hi, Mary.
Hi. One more question and comment, I guess, for Melanie. I just wanted to, I think in one of the slides I saw somewhere else, and I don't think you presented it tonight, we do have a employee opportunity for food security help. Is that correct?
That is correct. We have an employee food support. It is branded as our colleague market, which is a choice pantry for Virtua employees. There's one present at each of our 7 campuses. So anyone who is a Virtua employee and who needs a lift can just swipe their badge, go into the room. It is completely discreet. There's no qualifiers. If you feel you need some food supports, swipe your badge, go in, take what you need. No questions asked.
Great. Yeah, that's what I thought. And I just thought that was something that might be fairly easy to set up at many institutions. The other question that was for Dan, and just like, we were talking about how big of a percentage of our population is engaged in having food insecurity. And we have all these nice programs going on, but is there some way that you're kind of measuring, like what percentage of that, whatever, 12%, are we actually helping, and how do we make sure that we're kind of increasing every year with all the different things we're doing? How do we make sure we try to cover, everybody who has need? And again, we have so many disparate things going. Is there a way to collate that and measure it year to year?
We are, assessment and evaluation is probably one of the most challenging issues that we face. We are literally a staff of 4 people, and we're probably doing the work of about 400. This is a never-ending task and challenge for the department. We do a lot of programmatic evaluation, looking at things such as the impact and efficacy of the Food and Hunger Grant. I'm actually working on some reports for the governor around missed economic opportunities around federal reimbursement programs, such as the community eligibility provision, which allows school districts to provide free meals to every child in the district. New Jersey ranks 45th in the nation for adoption of CEP. It's absolutely a tremendous program. Just last week, I met with the superintendent from Mount Holly Schools. They opted in this year and served over 35,000 additional meals in this school year, an increase of almost 26% over the prior year. No child in Mount Holly Schools pays for school meals. It is all provided at no cost to them, and it's an absolutely amazing program. So we're currently doing some analysis around federal dollars that we have forfeited simply by not opting into these programs to create greater line of sight and accountability. When a school district tells me we're not going to opt in, I want them to not just tell me why, but to justify it. Show me the numbers. Show me that you can't afford it. I'll show you you're wrong. It's about willingness. The superintendent of Mount Holly School said to me point blank, we knew this was a need. We were going to move heaven and earth to make sure our district was in this program because we wanted to support Mount Holly students and their families. They had an amazing business administrator that made it work. So when I hear districts saying, no, we can't afford this, it's willingness. They don't want to make it work. The districts that do a tremendous job, and they are our unsung heroes in this sector. And I celebrate their successes each and every day.
Thank you. Thank you. So at this point, I would like to take some comments on establishment of MSNJ policy. And with that, I would just give one quick comment that I don't know if most physicians know what a screening is supposed to look like. So I think we should be working screening, how to develop that screening so that it not become embarrassing for patient or relatives to get into situation when we discuss. So screening tool is very, everybody talk about screening, but I'm not sure everybody knows the screening looks like. I'll open this floor for other comments for establishment of MSNJ policy from our leaders.
Yeah, I think what we'll do, and I think Dr. Like, we've already met with Dr. Dychtwald, the Jedi Task Force, and we've already taken and done quite a bit of work in this. So I'll, as Vice Chair, accept the charge of looking at some of those screeners. And in fact, I think at Virtua and at RWJ Barnabas, we do have the Hunger 2 screener universally used for some of our screeners into qualifying for our food pharmacy. But I think what we're asking for, Dr. Raval, is a MSNJ policy as well as maybe even a guide for our members on screening for food insecurity. So we'll accept the charge on that, and we'll begin discussing that development in our next Jedi meeting, if we are so inclined, Dr. Like.
Yeah, and I know that as a staff member at MSNJ, I know that we've done a lot of work in the justice, equity, diversity, and inclusion space to push out information that the Jedi Task Force has pulled together. We've used our website, we've used social media, we've used our weekly e-news, e-blast that goes out to the full membership of MSNJ. I think, to the extent that there are tools that we should be using to accomplish these goals, I think there are a lot of tools that we have at our disposal. So I'll work at making sure we're using them to the fullest.
If I could just add to that, the medical students on the Jedi Task Force have also talked about how much nutrition education is or isn't taking place in undergraduate medical education, residency training, and I believe at the national level, at least from HHS, they're pushing all the medical schools now to increase the number of hours. So that's another particular activity in terms of the physician pipeline, is getting people out there who know this, as well as continuing education. And one of the ideas that also had come up for the potential future is maybe their House of Delegates resolution to create a New Jersey Alliance for Food and Nutritional Security and accessing needed financial support to sustain an effort of this in partnership with other groups. So again, some ideas as potential next steps are listed in the chat. And I'm happy to send that as a Word document if that would be relevant.
Dr. Blumenthal?
I've noted that some New Jersey hospitals have established food pharmacies. I think that the Medical Society of New Jersey should put out a position statement strongly encouraging every hospital in the state to establish a food pharmacy. And at our end, we should establish a formal program to educate physicians and their assistants to work with these food pharmacies in a productive fashion. Thank you.
That sounds like to me, Dr. Blumenthal, that sounds like to me two resolutions, and I'd be happy to start working on that, given my great interest in this space. And at this point, I would like to even further propose for consideration in planning for our next annual meeting, for us to work with our stakeholders, with Dr. Dan, Melanie, Dr. Kulkarni, as well as, everybody else on the call, to maybe even have a 1-hour CME on food security and, the fundamentals at our annual meeting. I mean, I think this is really, top of importance. And I think this is an area where MSNJ, much like our New Jersey healthcare leaders, can lead other state societies in pioneering this going forward, and then eventually informing our AMA delegation and the AMA of our efforts.
Mary?
Yeah, I support everything that Dr. Like wrote in the chat. I think there's some nice steps there that we should try to pursue. And I guess I liked what Kennedy was just saying, because I was thinking, like, I don't know if I think we should wait for doing resolutions. I think these are things that we probably can try to initiate through the JEDI task force and those others of us who are interested. And again, I support, trying to develop some CME, developing a way to circulate for all our members a food screening tool that would be useful for them. And it would seem to me like we probably have some ways we could help to develop like a template for health systems to help, all of us may know people or be on certain medical executive committees, et cetera, that we might be able to help initiate starting a food pharmacy if there's not one in existence, if we could develop some templates for what needs to be done in order to support it. So anyway, I thought that we might want to think about taking some steps, and there certainly are resolutions. I'm sure, as part of the AMA delegation, we can bring those certain resolutions to the AMA where that might be appropriate.
Yeah, that's a very good suggestion. And Ms. McCarty?
Hi, yes, this has been a great conversation. I'm the CEO of the Community Food Bank of New Jersey, and we have started to partner with some health systems on, whether it's screening at pantries, but also at food pharmacies. So if anybody's interested in partnering, we have registered dietitians on staff. We do some health and nutrition education. We would be thrilled to partner with some of you. Food is medicine is something we're really committed to as part of our strategic plan.
Thank you for your volunteering in this efforts. And I think at this time, it's 8 o'clock, so we will conclude. I'm going to just say that I can only take the credit for the title of this talk. The main credit goes to Dr. Blumenthal, who brought the idea on this, and main work was done by Josh Bengal and our staff. So thank you, Josh, for everything you did for one of the most thought-provoking PSP. I also want to thank my co-chair, PSP co-chair, Dr. Miriam Modestine Sorrentino, and our MSNJ president, Dr. Henry Dindayal. As we conclude our inaugural policy and strategy panel meeting for this year, I want to sincerely thank each of you for your thoughtful insights, active participation, and commitment. Today's discussion has laid a strong foundation, and I'm encouraged by the expertise and collaborative spirit around this table. This idea we shared today are just the beginning. I look forward to working with all of you as we turn this discussion into meaningful action. Thank you again for your dedication and continued support. Our meeting is now adjourned.
Thank you.
Thank you all.
Thank you, everybody.
Thank you. Bye-bye.
Good night.